Hi, Alyssa. Okay, we've got you starting video.
I
hear
think,
you.
yep,
And I
for 1 more minute. All right. So I'll pull up my little blurb here. All right. So, hi everyone. Let me see you all. I don't know if you want to put on your video or not, but you are encouraged to. My name is Alyssa Gordon, and I'm the faculty lead for the Climate and Health Pathway. And I'm happy to let you know anything you need to know about this pathway and what we have in terms of the curriculum plan and speakers we've had in the past and that we would like to have in the future, and any other information about climate change and health during your med school experience. This pathway you've probably seen already is just starting its second year. So last year was our first year, and we had a total of 4 students last year. So 2 that were M2 and 2 that were M1. And I think it went pretty well. I didn't invite them to the Roadshow, but Nikila Yerabandi, who's going into M2, was at the tabling event that hopefully you guys were at. So yeah, I wanted this to be, you guys can ask me questions, or if you want, I can go over some of the materials that I mentioned. And then, you're welcome to reach out to any of the current students if you want any additional information than what I can provide for you this afternoon. So should we do like little introductions first? I said I'm Melissa Gordon. So I'm a gastrointestinal pathologist. I work out of the Cleveland Clinic, and I'm also medical director for medical director for sustainability for the Cleveland Clinic. And we have a whole big team. I'm not going to tell you about that as well here, and work closely with other case institutions and hospital systems on sustainability efforts through our education collaborative. And my day job is that I'm a gastrointestinal pathologist with a subspecialty in inflammatory bowel disease pathology, and I'm co-director of the GI and HPB service, pathology service at the clinic. And I started here in 2012, so got past 10 years. Things are going good. So can I call on somebody? Victoria, you're right next to me on my screen. So I'm going to introduce yourself and just tell us a little bit about your background and interests.
I'm Victoria. I am from Seattle. I did my undergrad here at Case. I've been in Cleveland for a little bit. Is there something else you want me to speak on?
Oh, just tell us, do you have like what sort of interest or activities have you done in related to sustainability or climate change?
I don't know if I've done like a lot of activities related to sustainability and climate change, but it is something, I think I took a course about it in undergrad. So it's been like something that's in my mind a lot.
Mm-hmm.
And I think especially like, climate affects everyone. So it's really hard for people to say like, oh, that's not important to me because it doesn't affect me, because it does. So, yeah.
Great. Thank you. Who's next? Lynette, you're next on my screen. Hi.
So, hi, my name is Lynette. I'm from Arizona. I went to Duke, and that's where I minored in environmental science and policy. And so that's kind of like why I'm really interested in climate health. And then I also did research in toxicology. So I kind of have an interest in how the environment impacts human health and how we impact the environment. And that's why I think this would be really interesting to see what kind of specifically in Cleveland and within the healthcare system, how that interplays with human health.
Great, thank you. Yeah, we had a big, the Cleveland Clinic had a big commitment to lead abatement in the community. I think it was last year or 2 years ago. So it's of high concern in our area. Keith?
Hello, sorry, I've been eating an early dinner now, so I keep my camera off. But yeah, my name is Keith. I'm an M1 at Case. I went to University of Michigan for my undergraduate degree. And I'm interested in the climate pathway because both my parents are in the environmental field. And I've just grown up kind of seeing things through that lens. So I feel like it'll be interesting to actually have an official connection between the environment and medicine.
Very cool. Thank you. You said University of Michigan. Is that where you're from, Michigan?
Yeah, I'm from Milford, Michigan, which is just 30 minutes north of Ann Arbor.
Oh, great. Welcome. The last person I'm seeing is Kaylin, if I'm saying that correctly.
Yeah, that's me. I'm Kaylin. I'm from Chicago. I went to the University of Illinois at Chicago. I didn't do a lot of work in climate at all, but my brother is building a climate tech incubator in Connecticut. So I just wanted to check out what this pathway is about.
Very cool. a climate, you said incubator?
Yeah, exactly.
Oh, cool. Very nice. Yeah, so welcome everybody. So essentially our fall semester for you guys, I'll just walk you through how the curriculum goes and what to expect. So for our fall semester, we have approximately 2 hours, but like an hour and 45 minutes. So it's from 6 to 7:45 p.m. on the second Wednesday of the month. And it's the M1, so it'd be you guys and the M2s who were here last year. And I bring in dinner for you guys, and the way that we spend the hour and 45 minutes is that we have a guest speaker. So that guest speaker has typically joined us by Zoom. So we're sort of sitting in a conference room together and eating, and then the guest joins, about 15 minutes later, and then does either a talk or an informal conversation or discussion, or a PowerPoint presentation, or I don't know, whatever we sort of would ask them to do, they can do. So we'd have to sort of like plan it a little bit in advance. And anyway, and then you can and then so that would be like anywhere from 30 to 45 minutes. And then afterwards, you can ask the guest speaker any questions and have a discussion together. And then at the end, we say goodbye to the guest speaker, and then we in the room just sort of debrief and talk about anything else that's come up that you guys had thoughts on. And then after each of those guest speaker sessions, we ask you to do a reflection exercise. And so I think it asks like 3 questions, like, what did you learn from the speaker? And think of a research question that's related to what you just learned, and something else that I forget. But that sort of goes, you do that each time we have a speaker, and that sort of goes into your portfolio for of reflections. And then we have those monthly through February, it turns out. And then in the spring of your M1 year, we have you enroll in an undergraduate or graduate course, depending on timing, availability, et cetera, and last year both students took the same course, which was a political science course about democracy and environmental sustainability. And it was really great because it was my first year doing it. Like I said, it was their first year doing it, and so we're not the first pathway to do a course or to ask you to do a course, but we were able to work with the other pathways who've done this before and come up with like a FAQ. So like now the process to like enroll in the course and find the course and figure out that you're going to take it, pass, fail, or audit or whatever is all in place. And there's no cost for the course, it's just all included. And yeah, and then last year the students sort of I guess negotiated with the professor to sort of say, here's what we're able to actually like handle during our semester, because you guys are still in med school and have to go to all your med school stuff. But they found it very valuable to go to that course. And we are pretty sure that this year, since you don't have the CP1 course, that there will be a lot more options for which university course you would take. because there was a lot of problems last year. It was like Monday, Wednesday, Friday, and they couldn't go every Wednesday and some Mondays and whatever, so it wasn't going to work out. So yeah, so there will be even more options. And yeah, so then in the fall of the M2 year, you would do this like the same thing. So it'd be the next group of speakers and you'd be with the new M1s. And so fall of M1 and M2 are similar, but with different guests. And then spring of your M2, you sort of get together amongst yourselves as a group, and I'm able to guide you and answer questions and help with resources and stuff, but you are mostly studying for your boards and stuff. So we don't ask too much of you, but basically you sort of start planning a event for that will be put on during the fall M3. So it's sort of like that year, spring M2 and fall M3 sort of go together. And that makes it so that your fall of M3, you don't have that much responsibility because you're just going to be starting your clinicals and stuff. So, this year the students are putting together a 1 hour flash talks. They're having like 3 different speakers over the course of the hour, and they're hosting it at the HEC during climate action week that the university has. So it's sort of going to be, they're able to plug into that existing programming and just like add their session into that programming, and they're inviting speakers and figuring out the format and all that sort of stuff. So it's good practice. And I can help connect to potential speakers and sit down and figure out ideas and stuff that you would have for doing that. So yeah, that's M3. And then the 4th year is like a project. And I specifically didn't, I haven't had any 4th years through the pathway yet. So I specifically didn't define, what the project, would be, or the scope of it really. It kind of just depends on how things are going and where your interests lie and how much time you really end up having. So, it hopefully could be something that's publishable. I have myself published in the field of healthcare and sustainability and climate and health and whatnot. So, I can help sort of guide you in projects and whatnot. And if you're not a research person, or that, it doesn't sound interesting, then, you could do something that's some other type of project-based learning where you're, either doing something more seriously with advocacy and climate, or in the community with climate or yeah, stuff like that. And then yeah, I'm open to it doesn't have to be like research. I know people aren't necessarily interested in that. So yeah, and then I will just say regarding research, several of the students in the pathway are already like working on, like plugged into research projects related to healthcare sustainability. So we have like some life cycle assessment projects that Akila is working on, and then a survey project that Kira is working on, and Trina, one of the M3s, she does research on the tree canopy with a colleague, and she was doing that before she came to the pathway even. So lots of opportunities. I think some of the value that it brings is like you will have you know, you will have some exposure to climate and health and sustainable healthcare delivery during your regular curriculum. Like you guys already went through Dr. Malloy's mapping exercise, and maybe I saw some of you guys there if you're in the room I was in. Yeah, so we, you know, both at the university program and the college program, we emphasize climate and health in the curriculum, and it's supported from the top levels. So there's that you'll get anyway. And then there's also, you know, student groups that are sustainability related. And then, you know, this is the sort of more intensive activity is to join the pathway. So questions about curriculum or anything I've talked about so far, or what else you want to know? Or
I was wondering about the class that you mentioned. Is that, what's the word? Are we auditing the class, or is that like you're actually like doing the assignments, taking the exam and everything?
yeah, that's a good question. So I'm gonna pull up the FAQ on that. So let's see. Pathway student course. Let me share my screen. Right here. See you. Let me figure out how to make this bigger. There you go. So this is the FAQ document that's like, you know, that we've shared with the other pathway leads that we created this document in coordination with the registrar from the university and the med school and Dr. Logio, et cetera, et cetera. So essentially, like, this is like what the students need to do. And then, you know, that there's no additional cost, general expectation, in terms of the coursework, and the class, and obviously varies significantly. And you could take the course and grade do go on your transcript. Most students tend to take the courses as pass or no pass. And you can ask the instructor, you know, we worked a lot with the instructor last year to sort of figure out what they wanted to do. And you may also audit the course, which also would require permission from the instructor. It turns out you can take graduate level courses if that's of interest to you, or just the undergraduate course. And last year, for the course that they took, it turned out the graduate course and the undergraduate course sessions were identical. It was just the graduate course students had to do more exercises, like more assignments. So they just took it as undergraduate. And yeah, so pass or no pass, or you can audit and sort of, like I said, negotiate sort of with the professor, and I can help with that in terms of, you know, they would provide the syllabus to you, and then you'd say, oh, this is the week of exams, or this is whatever, and you know, we have some flexibility with that. Does that answer your question?
Yeah, thank you.
Sure. All right, other questions?
Do you have an idea of what kind of speakers are going to be coming up in the next couple months?
Yes, I do. First, let me start by showing you. Okay. I can open this. I wanted to show you last year's speakers. There's something went wrong with opening time. Okay. Well, I can show you the So I made a summary of last year, and I have a nicer version, but it won't open right now. I don't know why. Something's wrong with my Acrobat. Let me share this. So last year we sort of had just a get to know you meeting, and then we had Dr. Duhame, who is professor of neurosurgery at Harvard Med School, and she had just written a book. And I'm so all of these are people that I know, and I am on the editorial board. I'm associate editor. She's you know, associate editor. She's like next in charge, next in line from editor in chief. I'm just blanking on what it's called. Anyway, we're also both guest editing a special issue right now for the Journal of Climate Change and Health. So she is a great person. She's actually, slowly winding down from neurosurgery and working more environmental stuff. And this was just like some copied material from the reflection. So I asked, what did you learn today? Connect what you learned today with what you already know, and give an example of how you can incorporate into your, patient interactions, and an example of a research question. So I can send you guys a copy, the nice copy of this. We had Dr. Khatri, who is professor and very long time supporter of climate change and health at the clinic. She's an asthma specialist, and she just actually left the clinic to go be the chair of the American Lung Association. So she talked to us about respiratory disease and air quality. Oh, this was fun. So in November, we had 2 of the CCLCM students who've been working with us on the curricular integration. And we had just published a paper on, that process, and that they're involved in research. So we had them sort of just informally come and talk to the pathway students. We just sort of met up at Van Aken and had a dinner and an informal conversation about research and opportunities. And then in December, we had Dr. Emily Sine. So she is at the Icahn School of Medicine, and she has really cool sort of interactive cases. And I still have those. If you guys are interested, we can go over them again. And then we had Dr. Amy Collins, who's an emergency physician. She's the medical director at Healthcare Without Harm. And yeah, so that was who we had last year. So this year we're going to be looking at the same, where did that go? Let me find, we're going to be looking sort of towards the same, genre and quality of people. Here it is. So this year, the people that I'm inviting, an emergency medicine physician, his name is Jonathan Slutzman. He's at Harvard, and he's the director of the Mass General Harvard Environmental Center. And he does a variety, I worked with him in a variety of different ways, but we're both sort of advisors to Amy Collins, who I mentioned. And we both have been working, in this field for a long time. So just sort of our paths have crossed, and we've written papers together and stuff. So he's actually, a good person to talk about leadership, and he does a lot of his research is around life cycle assessment. Another person is Mark Futernick. He's out in California, and he actually has like a climate podcast, and he does a lot of like social media around it, and he's also an emergency medicine physician. A lot of physicians in this field are emergency medicine, but that's starting to diversify. And then two anesthesiologists that I know, Jody Sherbin, she's the I've known her for many years. She's at Yale, she's an anesthesiologist. She's written the Anesthesiology Society of America guidelines on environmental sustainability in the OR. So she wrote that originally, and now there's supposed to be an update coming out that she also co-authored. And then she also is best known, I think, for when we talk about the environmental footprint of healthcare delivery in the United States. A commonly quoted number is that the U.S. Healthcare sector contributes 8.5% of U.S. greenhouse gas emissions, and that 8.5% number comes from Jody's paper. She first published in 2016, and then there was an update in 2020, I want to say. So she's been at the forefront of that. The impact of how we practice medicine on climate change. Another person is a physician here at the clinic. Her name is Tara Hatta, and she's also anesthesiology. She's involved in, more specifically like ways in the OR that they are reducing the anesthetic gas emissions through low flow and, local versus general anesthetic and all that sort of stuff. So she would be able to talk to us about that. Another person is Aparna Bol. She is a pediatrician at UH Rainbow Babies, but she also since 2 or 3 years ago now has taken on a role at what's called OCHI in the government. So it's called the Office of Climate Change and Health Equity. And they've been very active lately, and she's been very busy, but she's still here and still involved in some ways, in a lot of ways with climate change and health locally. So she would be able to give us all sorts of different perspectives, depending on what we want her to discuss with us. Next person is, her name is Cecilia Sorensen. She had done a climate and health fellowship out in Denver, and she's now the director of the Global Consortium on Climate and Health Education, which is at Columbia School of Medicine, or School of Public Health. And so she's got her, the GCCHE, the Global Consortium on Climate and Health Education, is a really wonderful repository and partner in a lot of international educational endeavors related to climate change and health. And then I also will be inviting Janine Morley. She's one of your guys' colleagues. She has been working very closely with Dr. Malloy for the past couple of years on integrating climate and health into the UP program curriculum. And so I thought it would be fun to have her come and, tell us more about herself and her interests and what her experience has been as a student in the field. Good. It's subject to change. I haven't confirmed everybody yet, but they're all, like I said, it's all people that I know and have worked with over time. And so, usually we can work it out. Other questions?
For the courses we have to take, I know that there is like often scheduling conflicts, but other than that, are there like other like requirements for which courses we can take that would like fulfill the requirement?
Oh, that's a good question. So I mostly, the idea is that you take a course that is sort of in some way related to environment, sustainability, climate. So whether you want to like delve into climate science that has nothing to do with health, that's totally fine. Whether you want to dive into, environmental engineering, that's, whatever, course that might be, that's totally fine. So this particular course that they took about democracy and environment and stuff is one that some of the environmental engineering students also have to take, and like for their undergraduate degree, and it's just been very well received. So I have a list of courses, but it changes what the offering is every year. So I'm of course available to help you figure out which courses are options, and help with communicating with the instructor to find out, if they are able to have you as an audit student, or make accommodations for you, because we've had good luck so far. Like I think that the university program, the undergraduate university professors and schools kind of are on board with this, and it's not like there was a big announcement that they might have med students in their class or something, but they're super nice and have been very flexible and accommodating. So I'll be able to help you navigate that as well. Good questions. What else? I'm happy to answer any other questions about, if you want to know how I got in this field, or what my day looks like, or anything else about, how this fits into med school days versus, staff days, whatever you may be interested in.
You mentioned that a lot of doctors in that field with environmental like health and climate change are like emergency medicine physicians. Like how does that relate to each other? And then also like what's the relationship that you've been able to make with like pathology?
Very good questions. I don't entirely know about how or why there's so many emergency medicine physicians who got involved so early. Like I said, now it's a little bit more evened out, but a lot of the people who've been in the field for a long time, there was always, emergency medicine. I think what there's two things really. So we have a trauma surgeon here at the clinic, and she's been involved in this work for a long, long time. And for her, it's about greening the OR, like, making sure that they're not like overusing stuff in the OR to treat the trauma patients, but also it's about, when there's extreme weather events, there's trauma, and there's physical trauma really, which is what she deals with, obviously, like in addition to all the mental health issues. But people break bones and whatnot, and trying to flee from storms and such. So I think for her, for a trauma surgeon, she's sort of like both delivery of care and how climate affects her patients. But also, so for emergency medicine, it's kind of the same thing. Like, there's obviously it gets to be quite an emergency when, the whole town is flooded and everybody has to evacuate and people only brought 1 week's or no week's worth of their medications, and they have to, figure out how to manage that situation, or they may be, in the middle of chemo or something, and then they have to stop. There's all sorts of like things that are sort of emergencies. And, so I think there's that. I think also because their schedule, I think they have time to get involved in stuff more, kind of like pathology. But yeah, I don't know. We can ask them too, like why they think there's more. I think that the emergency medicine, their professional society also like was on board early. So I think that helped spur the movement in that subspecialty. For me in pathology, search path lab medicine, I kind of like am the type of person who read my Ecology 101 book from cover to cover when I was in undergrad. And so I like always been interested in it. And then waste really is my angle. And so being in labs, like I did a PhD and being a pathologist, so all that lab experience, there's so much waste, so much single use disposables. And, so it was always bothersome to me that I would, be so diligent at home. And then, at work, it would be like, not even thinking about it. So I started thinking about it, and then, started a student group when I was in med school in Houston. And we sort of went around to some of the local elementary schools and, taught them about health and hygiene and, say like turning off the water while you brush your teeth, and, how to recycle in the town and stuff, and helped paint recycle bins with them for their school. And then various other projects with that group. And then I was going to a lot of, so there's meetings. Oh yeah, I forgot about that. The M2 students each went to a meeting in the spring as well. So one of them came with me to a conference that's called Clean Med that I have been going to since 2009. And it just happened to be in Pittsburgh, so we just drove down there. And then the other student went to she's the one who's interested in tree canopy. So there was a tree canopy all-day conference here in Cleveland. So she was able to go to that. And again, we subsidize the registration, or we cover the costs really. Anyway, so I had always seen Jody Sherman, who I mentioned before from Yale. I always saw her at all the Clean Med conferences every year. And she, like I said, is like very seriously researching and publishing to get the 8.5% number and whatnot. And so she would always tell me like, hey, you need to do research, you need to do research. And I've done a ton of research, obviously, just in inflammatory bowel disease and GI and pathology, whatever, but never figuring out how to do the climate connection. So Jody actually invited me because they were doing a paper on prostate cancer and sort of the environmental footprint of, extra screening versus not, and using an MRI versus not. And so she pulled me in to do the pathology portion of it. So like getting the biopsy, putting the formalin jar, processing it through the lab and whatnot. And so I was like totally on board with doing that. It was my very first like LCA project, life cycle assessment project. And it was like my very first project that was related to, combining my two worlds. And so we actually were able to publish just the pathology portion of that as a separate paper, and got like a podcast interview out of it, got like all sorts of cool stuff. Yeah, so, and then I made it about GI biopsies for that one. And then, then finally everybody else comes around with the rest of the prostate work. And so then they could just reference my paper because there's all this other stuff that needs to go into the prostate paper. So we just crunch some numbers a little differently and referenced the methodology for the prostate paper to do the processing of the prostate biopsies as compared to GI biopsies. So that is so far how I've been able to combine my two worlds, but also, like I said, the curriculum stuff we published in that, like integrating the climate health into the curriculum. And then also just general, there's a few papers I'm on about just like greening the OR stuff, because here we have greening the ORs combined with anesthesia, which everybody has, like combined with anesthesia, surgery, but also here we add the labs because there's, again, a lot of similar overlapping issues. So, yeah, that answer your question? Good. All right. Any other questions? Okay. Is everything going okay for your first like couple of weeks of med school? It's kind of what you expected or not? Thumbs up more or less. Good. Yeah, we try that, hopefully you guys will apply for our pathway. And I know that Lisa included in one of the emails, like the links and stuff. So if you fill that out on the Google form, that's obviously the easiest. Just enter your information there. And yeah, I don't know if any other parting questions, but yeah.
Oh, sorry to interrupt. I just had a quick
That's
question. I was looking at the application on the Google survey thing,
Mhm.
and it asks for a current CV. I was wondering if a resume would do, or if you want specifically a CV.
Yeah. We just, sorry. It's that time of day that my family calls me. Yeah, so a resume is fine. We just call it a CV here. Like a resume is like the same thing as your CV, but when you get into like academic medicine, everybody just calls it a CV, and resume is more like what I think business people call it. Same thing though.
Okay, thank you.
Sure. Alrighty. Well, I appreciate you guys spending some time hearing about our pathway, and I hope to see your your applications soon, and we're looking forward to having a great year. If any of you want to talk to the other students, like I said, I'm happy, they're happy to talk with you, and I can just email me or email Lisa Goodman, who's the administrator on the call here, and we can get you their email addresses so you can ask them any other, student to student questions. But all right, sounds good. I will let you guys go. There's one chat thing here. Oh, reach out with any questions, right, to Lisa or myself. All right.
All right, thank you.
Sounds good. Thank you all so much.
Bye-bye.
Bye.
Okay.
All
Good
right.
job.
Sounds good.
All right, we'll see you soon.
Okay. Thanks, Lisa. Appreciate it. Bye.
Bye.